Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine doctors could take a tiny sample of your cancer and maybe within a week test a whole bunch of treatments right on those cells
In the lab, yeah.
to figure out the best combination specifically for you. For people dealing with rare, complex cancers like soft tissue sarcomas, where, standard treatments often fall short, this isn't science fiction anymore.
No, it's becoming a reality, fast. And that's really what we're digging into today. There's this compelling new study providing strong evidence for using this kind of personalized approach.
For soft tissue sarcomas specifically.
Yes, to really improve how treatments are selected for those patients.
Okay, let's break that down a bit. Soft tissue sarcomas.
They're pretty uncommon, right?
Very. Less than 1% of all cancer diagnoses overall.
Wow. But I read they're actually a significant chunk of cancers in younger people.
That's the tough part. About 20% of cancers in children and young adults. And they're really diverse, lots of different subtypes.
Which makes treatment tricky, I imagine.
Yeah.
Exactly. Conventional chemotherapy. Well, it's often unpredictable. The results can be all over the place because the tumors themselves are so biologically different from each other.
And that diversity is what this research tackles head on.
Precisely. Because they're rare and so varied, doing those huge clinical trials needed to find the best standard treatments. It's incredibly difficult.
Right, you just don't have the patient numbers.
So research has been pushing towards more individualized methods, ways to understand and target these specific cancers better.
Okay, and that brings us to the sources we've been looking at for this deep dive.
Yeah, we've got a scientific paper, a detailed one,
Yeah.
from NPJ Precision Oncology,
Okay.
and also a related health news article. Both of them focus on this innovative technique. It's called the Quadratic Phenotypic Optimization Platform.
Quadratic Phenotypic Optimization Platform.
A bit of a mouthful.
It is. We'll probably just explain the idea behind it. But yeah, they're looking at how it's used for soft tissue sarcomas. So our mission today, for you, the listener, is to really unpack this, understand how this system works, what it could mean for treating these really challenging cancers.
And, what the future might look like with this kind of approach.
All right, let's dive into the study then. What was the main goal the researchers had using this Quadratic Phenotypic Optimization Platform?
Well, the core purpose was simple. Could this personalized medicine strategy actually lead to better treatment choices for soft tissue sarcoma patients?
Because the standard ways weren't cutting it.
Often, yes. And given how hard big trials are for these rare tumors, they wanted to see if analyzing each tumor's unique traits could help find treatments that work better and, importantly, are less toxic.
Okay, so how does this Quadratic Phenotypic Optimization Platform, how does the technology actually work? It sounds complex.
It is pretty advanced, but the concept is straightforward. It's a data-driven platform using what's called phenotypic screening.
Phenotypic, meaning how the cells look or behave.
Exactly. Instead of just sequencing the genes, you're watching how the actual cancer cells react when you expose them to different drugs.
Okay.
So the platform tests a panel of drugs, some already approved, some still experimental, and different combinations of those drugs.
Directly on the patient's own tumor cells.
Correct, on samples taken from the patient. And the really remarkable part, it generates results in about 7 days.
Wow, 1 week. That's incredibly fast in the cancer world.
It really is. Time is critical.
So what did the study actually involve? What did the researchers do?
They collected tumor samples from 45 patients. All had primary soft tissue sarcomas.
45 patients. Is that a lot for this kind of testing?
It's actually the largest group reported so far for this type of direct ex vivo, meaning outside the body, drug testing in soft tissue sarcomas.
Okay. And what did they test on these samples?
The platform analyzed a preset array. It was 155 different test combinations, all derived from a set of 12 specific drugs.
Okay, 45 patients, 155 combinations per sample. That's a ton of data. What were the key findings? What jumped out?
Several really important things. First, they checked the platform's accuracy. How well did its predictions match what actually happened when patients got standard treatments?
Right. The validation step.
Exactly. And it was pretty impressive. In over 70% of the cases, the platform's results correctly predicted whether a patient would respond to the standard of care drugs.
70%. That gives you some confidence in the system.
Definitely. It shows the platform is reliable in reflecting real-world responses, at least for those standard drugs.
What about the harder cases? Patients whose cancers weren't responding anymore.
This is where it got really interesting. For some of those patients, the platform identified drug combinations you would normally think of for their type of sarcoma.
Unconventional approaches.
Yes. And in 2 specific cases, these guided treatments led to really compelling clinical responses, significant positive effects for the patients.
Can you give an example?
Sure. One patient had a very aggressive type called a solitary fibrous tumor. They benefited from a drug called Pazopanib,
Okay.
and later another drug, eribulin. Both choices were guided by the platform's testing on tumor samples taken from different spots in their body over time.
Wow, so it adapted as the cancer perhaps changed.
It seems that way, yes. Another patient had a rare liver cancer, hepatic embryonal sarcoma. The platform's results matched up well with how the patient actually responded to several different treatments they received, like doxorubicin or gemcitabine with docetaxel, and Pazopanib again.
So it's potentially finding lifelines when the standard playbook runs out.
That's the hope, exactly. It shows potential for finding alternatives.
Now, you mentioned drug combinations. Did the study find any completely new potential treatments?
It did, and this was another major finding. The platform identified a specific combination. It was AZD5153,
AZD5153.
which inhibits a protein called bromodomain containing protein 4, BRD4 for short, combined with Pazopanib, that multi-target drug we mentioned.
Okay, that combination.
This combo actually seemed more effective than the standard chemotherapy used, that's ethosfamide and doxorubicin, across several different soft tissue sarcoma subtypes they tested.
More effective than the standard. That's huge.
Potentially, yes.
Yeah.
It suggests this could be a superior strategy.
And did they just see this in the lab dish, or did they investigate further?
Oh, they took it further. They validated it using patient-derived cell lines.
So lab-grown versions of the patient's tumors.
Right. And also in animal models, in mice.
What did they find there?
They saw that this AZD5153 and Pazopanib combination was effective at suppressing MYC.
MYC. That's a big cancer gene, right?
A very important one, yes. It drives cancer growth, but it's notoriously hard to target directly with drugs. This combination seemed to hit MYC indirectly and also affected other pathways important in these sarcomas. Think of MYC like a master accelerator for cancer cell growth.
Okay, so hitting it is good.
Very good. But finding drugs that can do it effectively and safely is the challenge.
So how did these 2 drugs, AZD5153 and Pazopanib, work together so well? Was it just additive?
It was actually more than additive. They found the drugs acted synergistically.
Meaning the combined effect was greater than just adding their individual effects.
Precisely. The combination led to more cancer cell death, that's apoptosis, and it stopped the cell growth cycle more effectively than the standard chemo did.
And that synergy was linked to hitting that pathway you mentioned.
Yes, it seems linked to targeting that bromodomain-containing protein 4-MYC axis, that pathway.
Okay. And the animal studies. The mice.
In the mice that had soft tissue sarcoma tumors, this combination significantly reduced the tumor size and slowed down the growth rate compared to using either drug alone.
That's promising. What about side effects in the mice?
Importantly, the mice didn't lose significant weight, which suggests that the doses they used were tolerable. That's always a key concern.
Absolutely. Okay, this all sounds incredibly promising. Stepping back, what are the big picture implications of this research?
Well, they're pretty substantial, I think. First off, this platform, the Quadratic Phenotypic Optimization Platform, it offers a real path away from this sort of one-size-fits-all approach.
Which doesn't work well for diverse cancers like sarcomas.
Right. By predicting how an individual's tumor will respond, you can potentially pick treatments that are much more likely to work for them.
That just makes intuitive sense, doesn't it? Tailoring the treatment.
It does. Secondly, for patients who've run out of standard options, maybe their cancer has become resistant. This platform might identify alternative strategies, offering new hope for getting the disease under control.
Finding plan B or C or D when needed.
Exactly. And thirdly, that specific discovery, the AZD5153 and Pazopanib combination potentially being better than standard chemo. That could be a major leap forward if confirmed.
And this study really highlights the value of this kind of testing for rare cancers specifically.
Absolutely. For rare cancers, big trials are tough. And sometimes, just looking at the tumor's gene's genomics doesn't give you clear targets. You might not find known actionable mutations.
So you need another approach.
Yes. This functional approach, directly testing drugs on the cells, sees how they actually respond. It can be invaluable in those situations.
And could this platform be used for other cancers too?
While this study focused on sarcomas, the success here definitely suggests it could potentially be applied much more broadly to other cancer types as well.
Okay. Now, we should also talk about limitations. No study is perfect. What are the main caveats here?
That's always important, yes. First, the concordance analysis comparing the platform's predictions to actual patient outcomes, while over 7%, it was based on a relatively small number of patients overall.
So need more data to be absolutely sure.
Ideally, yes. And related to that, the exciting findings about the AZD5153 and Pazopanib combo, very promising, but they really need confirmation in larger prospective clinical trials.
Trials designed specifically to test that combination from the start.
Correct. And I understand a trial like that is actually being planned in Singapore.
That's good news. Any other limitations?
Well, the study included various sarcoma subtypes, but we still need more research to know if that new combination is effective across the board, or maybe just for specific subtypes.
Subtype specificity. Okay.
And finally, cancer resistance is complex. Even if this platform finds an effective treatment now, the cancer could still develop resistance later on. It's an ongoing battle.
Understood. It's always helpful to hear directly from the researchers, too. What did they say about their work?
Assistant Professor Valerie Yang, one of the key researchers, she called it game-changing.
Strong words.
Yeah. She highlighted two main points: that this ex vivo testing can accurately predict patient responses, and that it can provide crucial info to help control the disease in patients who've exhausted other options.
So both prediction and finding new paths.
Right. And she also mentioned the excitement around that new drug combination, saying it may supersede existing treatment.
Yeah. What about other experts involved?
Dr. Tan Boon To, another leader on the study, described it as a pivotal step. He emphasized moving towards truly functional precision medicine.
Functional precision medicine, meaning based on how the cells function and respond.
Exactly. Using the platform to match patients with optimized drug combos based on their tumor's actual biology. He said it offers real hope for better outcomes where standard treatments haven't worked.
It really does sound like a significant advance, particularly for these difficult-to-treat cancers.
It feels that way.
So let's try to summarize the key takeaways for you, our listener, from this deep dive. What's the bottom line?
I think the main takeaway is that these personalized medicine tools, like the Quadratic Phenotypic Optimization Platform, show real significant promise for soft tissue sarcomas.
I'll say.
They can more accurately predict drug responses, which helps doctors choose better treatments. And they can also help discover completely new, potentially more effective combinations, like that AZD5153 and Pazopanib 1.
And why is this research important for you, listening now?
Well, if you or someone you know has been touched by a rare or challenging cancer, this research offers a tangible glimpse of the future.
A future where treatment is more individualized.
Exactly. Tailored to the unique biology of your tumor, not just a standard protocol. And that holds the promise of, hopefully, better outcomes, maybe fewer side effects, and definitely more hope.
That is a hopeful outlook. Okay, before we wrap up, here's something to think about. As this kind of technology keeps advancing, how might we see these personalized approaches change treatment? Not just for rare cancers, but maybe for all cancers.
Could we be moving away from standardized protocols entirely?
Towards truly individualized therapies for everyone, what kinds of questions does that raise for you? About the future of cancer care, about costs, about access, and just the incredible role technology might play.
Lots to think about there.
Definitely something to ponder. We encourage you to check out the resources in our show notes if you want to learn more.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.